Hello everyone, my name is Laura Everson, and this presentation is for SNUG 331. Today I will be discussing tuberculosis prevalence in immigrants in Australia, including its causes, symptoms, prevention, and treatment, and the impact it has on individuals and public health. This presentation will also explore the use of AI and compare the capabilities of AI in determining whether it can be a useful tool. Goals and target audience. The goal is to raise awareness, promote vaccinations, and encourage early testing to decrease the possible spread. The target audience is immigrants and overseas-born Australians, Australians who work in the New South Wales health as they can be exposed, and people travelling from high tuberculosis risk areas. The reason why is to educate the population that tuberculosis is not a major risk in Australia, but more screening and prevention should happen for overseas-born Australians. In Australia, we have a population of 27.7 million people, and 32% of that number, being 8.8 million people, are overseas-born or immigrant people living in Australia. Approximately 1,400 people are diagnosed with active tuberculosis in Australia annually, with overseas-born individuals and recent immigrants accounting for nearly 90% of these cases. While active TB is relatively low in Australia, an estimated 17% of overseas-born Australian residents have latent TB. So I used AI to support my research process. I used AI to search for the background information about TB, such as what it is, prevalence, symptoms, and prevention. I used AI to create the infographic to compare whether the information is up to date and relevant to my case. The accuracy of AI in medicine depends on the task. It does not excel at pattern recognition. It does excel in pattern recognition in medical situations, but it's not reliable for direct consumer health advice. Errors in AI can only give information that stems from its reliance on statistical pattern recognition rather than actual human reasoning. AI can give information from sources and help with the research work, but when it comes to working with patients face-to-face, a nurse is better at the patient-centered care and able to give more accurate care to each patient and their case. I compared AI to different sites such as World Health Organization, the Australian Centre for Disease Control, National Health and Medicine Research Council, and National Library of Medicine. And it showed that AI, when asked, will provide a reference to its answers, showing that its information is relevant and can be fact-checked. Evidence review and fact-checking. So I compared the information given by AI to different health sites like WHO, the Australian Centre for Disease and Control, and others. And I asked AI to provide me with the reference as where it got it from, and it provided me with several links and references that it used to help provide information about TB. Evidence-based information strongly shaped both the content and the design of the tuberculosis infographic. Reliable health sources, including the World Health Organization and others in New South Wales Health, they were used to ensure that the information was current, accurate, and aligned with public health recommendations. Evidence guided the inclusion of key topics such as TB transmission, symptoms, diagnosis, prevention strategies, treatment options, and possible complications. And the research also influenced the visual design of the infographics. Health education evidence suggests that simple language, visual icons, color-coded sections, and concise text improve understanding and engagement, particularly in audiences with varying levels of health literacy, such as a result, the infographic used medical illustrations and organized sections to make complex information easier to read and remember. The design aimed to support effective health promotion by presenting evidence-based information in a visually accessible and educated format. The infographic. So this is the infographic that was created by AI image generation technology to design a visual, engaging, and educational poster about tuberculosis. The information was gathered from reliable health sources such as the World Health Organization, Centre for Disease Control and Prevention, and New South Wales Health to ensure that the context was evidence-based practice and accurate. The infographic was designed using AI generative tool that organized the information into clear sections that I had provided. So pathophysiology, diagnosis, prevention, treatment, and outcomes. And the layout was created to make complex medical information easier to read. The infographic was created to educate the public, general public, students, and healthcare learners about TB in a simple way. The goal was to increase awareness of TB, including how it develops, how it is diagnosed, ways to prevent transmission, available treatments, and possible complications. The design uses concise wording, bold headings, and visuals such as icons, medical illustrations to support understanding, again, with people with different types of health literacy. Color-coded sections, again, helping to separate each topic clearly and allowing readers to locate the important information. The use of simple language and step-by-step explanation makes the infographic suitable for educational settings, community health promotion, and patient awareness. So here I have compared the infographic diagnosis with the World Health Organization and seen that the information provided is accurate and reliable. As you can see there. I also compared treatment and prevention plan with the Centers for Disease Control and Prevention, and the information was relevant, correct to the information on the CDC. So that's prevention, and this is treatment. The pharmacological management being correct. Critical reflection. So what I learned about using AI ethnically in nursing practice is that it can be used as a tool to help with up-to-date information from reliable sources. It creates like a clear understanding to help and support healthcare professionals in finding complex medical information more easily and simply, that it will help with reducing workload and support productivity, but over-reliance may negatively affect independent learning and clinical reasoning skills. I also learned that it is important to check your AI your AI generated information against trusted healthcare sources such as WHO or other hospital guidelines before using it in practice of assignments. The strengths and limitations of using AI is that it can be used in many ways to help and create more productive and easier workload for nurses, but it cannot take away the fact that nurses are not only well educated but also have critical thinking, human-centered care, and have more medical experience in recognizing those early critical signs in patients. Bias and misinformation can occur in AI-generated content, meaning nurses must evaluate information carefully and recognize limitations. A nurse is better at patient-centered care and able to give that more accurate care to each patient and their case. So in conclusion, tuberculosis remains an important health issue in Australia, and AI helped me with the information in providing that it can be a tool, but not to overuse it. Through this presentation, I've highlighted the importance of evidence-based healthcare, public awareness, and the role healthcare professionals play in creating accurate and well-centered care with the help of AI. Thank you.